Our clinic here is beautiful. There is beautiful greenery, trees.
Hello, welcome to Rogers, Seattle.
And then whenever you come into the building, there's just so much light here inside the clinic, living walls. It's really a comforting space to work on your mental health. It's beautiful, and being able to be in an atmosphere that really is uplifting and helping you to work on the parts of life that are harder in that moment.
The goal is really to help patients to get back to where they are functioning and able to live their life the way they value it, the way they wanted to. I mean, living with OCD, living with anxiety, it's like a full-time job. So a program like Rogers really helps these patients to be able to take a pause and really focus on their mental health.
We really want to welcome families. And to do that, we've got this incredible space that families use as a working area during their day so that they can be available to their loved ones, as well as kind of keep the day-to-day life things going on. And so being able to be here and present really adds to their capacity to be involved in treatment.
We have a team of individuals who are supporting a patient in all aspects of their life. So we have a psychiatrist, we have a nurse, we have a therapist, we have a behavioral specialist, we have a psychologist on the team. And all these people are working together to really meet patients where they're at and really help to set them up for success.
We know that the combination of therapy and medication is going to be better than either medication or therapy alone. If someone's anxiety is so high that someone is going to be spinning their wheels and not able to get the traction, that's exactly the role of the medication in order to bring down those waves of anxiety to more approachable levels to then have more success in treatment.
We follow a pretty similar schedule, whether it be on the child and adolescent side or on the adult side. Our patients come in, they have a group check-in. After that, we break off into some level of individual work. And that is really ingrained in the Rogers model, is that there's a big chunk of each morning dedicated to some self-directed, self-initiated exposure work or behavioral activation work.
The idea of behavioral activation in particular as a treatment of depression is doing exactly the opposite of what depression would have you do. It's interacting with people, it's preaching approach rather than avoidance of a given task. And that is analogous to our other main line of treatment, exposure and response prevention for anxiety and OCD.
After lunch, we break off into a cognitive behavioral therapy group. And this is really a combination of psychoeducation, learning specific skills, and really pressing people to identify how can this filter into my daily life? Where could I use this at home or in my relationships or at work? It's a level of progress that we don't see in typical once a week outpatient treatment. It's a really special level of care where we see big moves being made.
One of my favorite exercises that each of our patients does at the end of treatment is they write a letter to a new patient, a future patient. Folks are really opening their hearts and saying, this is what was really hard, and this is the journey, and this is where I landed. And they're so inspirational. It's a pretty special place.
We want patients to manage their OCD well while they're here, but more importantly, we want them to be able to manage it in the future when it does pop up. So when we say discharge planning, it's a combination of working with the team who the patient will discharge to, as well as equipping them with tools that aren't just relevant right here, right now, but that they can pack up and take with them to school and work and into the future. I really like that we're the type of place that will say, yes, come, welcome, here's what we can do, and here's what we can help you plan for next time. It feels really indicative of what our community needs right now.